Good morning, everybody. Today we see about one interesting topic: vitamin D versus COVID-19. What is the relation between both vitamin D and versus COVID-19? At present, so many research are going regarding to vitamin D versus COVID-19. We can see deeply regarding this both. First of all, I want to say, if you want to shine like a sun, first you burn like a sun. Dr. A.J. Abdul Kalam say. You see, every day or morning, you can see the sun rises, everybody. So you can feel the day is very good or nice, a happy and nice days. So, what in vitamin D? First is C. Vitamin D is a fat soluble or substance. This is a body need to develop normally. Vitamin D is help for the calcium. Calcium is one of the main thing for black our bone. Vitamin D also helping the bodies for sufficiency of calcium and phosphorus. The minerals are very required for our body to make strong for them. For lack of vitamin D, for example, osteoporosis, support records vitamin D deficiency, nervous problems, muscles and immune systems. This all should be affected. Because what is the related to COVID-19 and vitamin D's we can see is first, you see them how the vitamin D is there. Vitamin D normally sun rising, their body skin will be the vitamin body our skin will be observing, and after observing they go for liver, and liver should be what they're doing. The symptoms of vitamin D, the calcium absorbing from the our small lesion and oxen calcium reabsorption from the kidney. This is a process of for the for doing for from the sun to liver, liver to kidney they do. So what the vitamin D deficiency what happened? Vitamin D deficiency means do not have the vitamin D in your body unique because of your skin actual procedure using from the sunlight. Fair skin individually who have younger convert to sunshine vitamin D fair between better than those who have dark skin of over the age above 50. Especially our main of nowadays culture lifestyle what happened a very full fast lifestyle what happened they never always sitting in the AC always seeing the monitor they never to go for the sun because of especially this lockdown period covid-19 lockdown period there also never saw the sun exposed at least you have garden you go outside little bit or you have terrace upstairs you can go at least 20 minutes at least you can go 15 to 20 minutes to expose the sun because of sun naturally with the freely you are getting get for vitamin D no need to pay the money anything types of vitamin D is there vitamin D1 D2 T3 T4 T5 there's a types of vitamin is there especially research article says nowadays if you have reference you can see here so many research article is there covid-19 death are being linked to vitamin D deficiency related so many research going and covid D a rapid review evidence treatment prevent from covid-19 like so many is going sir what the research article results saying for example death rate compare with other people. So vitamin D who all are more they have should be symptoms also sometimes symptoms also more high that people also reason for to more affecting for them especially vitamin D this is what vitamin D deficiency I am not saying about them still research process is going on but can you reduce for the risk from the infection that purpose help for vitamin D covid-19 more affected country for example America Italy Spain Britain France for example these are all country let people they're taking some research previous article I'm showing that research people what they're doing they conducting which vitamin D high person escape from the disease because of death rate is reduced that type of country suppose the vitamin D less people are more affected vitamin D who have less they have vitamin D they affected especially above 60 years age people vitamin D less level because of they have age related normally our human being body age going time calcium should be vitamin D will be go down. So osteoporosis, like the arthritis related problems, fractures, so many issues, their health issues related. So COVID-19 they're completely oversells from the impact of vitamin D. So there this is the main things of they're saying for regarding vitamin C. Next is the causes. What are the causes? Six fibers, for example, if you have tensions, observe from the enough of vitamins, your body for intestines have the intestines have to absorbing enough of vitamins. Sometimes weight loss, surgical, any reduced stomach for any bypass part of small intestine or obesity or kidney or liver disease, lack of enzyme. These all causes for them. Next one is what are the other factors can be lead to vitamin D deficiency? One is age, mobility, skin color, dark color. For example, age, old age people, mobility. Sometimes they're living lifestyle, environment, geographical area. Sometimes some people are living in cold environment. They never see the sun's like skin color. For example, dark color skins are less able to make the vitamin D to fair color skins. And breastfeeding infant in the sometime infant have not breastfeeding insufficient need to vitamin D. So they have lack means that also should be factors to be. Next one is what are the signs and symptoms of vitamin D deficiency? First one is fatigue, bone pain, back pain, muscle weakness, and cramping, mood change, depression, regular sickness, infection, impaired wound healing, hair loss. These are all things you can see the signs of the see the picture, mood changing, bone losing, muscle cramping, bone joint pain, fatigue, this all. Next one is for the normal sponge of spoons. For example, osteoporosis, muscle pain, weakness. This all see the picture that I given for. Next one is the vitamin D deficiency continue for long period of complaints. For example, cardiovascular condition problem will become autoimmune problem should be. Why I am saying you can understand because of our immune systems, autoimmune problems will become because of the vitamin D deficit. Next one is neurological diseases. Anything for common infection, pregnancy complaints, pertaining to cancer, especially breast prostate, colon, leg cancer should be chances for these are complication for vitamin D. Next one is how is vitamin D deficiency diagnosed? For example, how can diagnose? Sometimes vitamin D level can be checked by as the causes of symptoms a long lost body. For example, state of fall, bone fracture, sometimes without any significant of trauma, like we can see. Next one is blood test, low with THOH vitamin D test. For example, low blood level for not getting enough of vitamin D problem or for the observation. For example, with observation from the industry, the high level of supplementation of vitamin pills or other nutrition supplement. These are all things we can diagnose. We can how can it is what are the source for vitamin D? Try through your skin from your diet. Better this is the way. Next one is main source is 15 to 20 minutes, 3 days at least per week, especially old age people. I am saying not only old age, every people, but especially old age people want to do body from the vitamin D naturally export from the sunlight through the nutritional supplement. Also, sometime vitamin D, but nutritional supplement you can advise get from the consult your doctor and take for the medicines. Next one is how can I help to prevent from the vitamin D deficiency? For example, eating more foods contain vitamin D, getting some expose of sunshine, but too much of not too much expose. Exactly how much you can sun expose need to clearly 10 to 15 minutes sun expose for them, and play the games. Nowadays the school children are never play the outside game. All are inter game mobile gadgets they are living. So I told for go for outside and get exposed for them. Play the game in school time. You are play game period. You go to play for them to involvement because of sun will be that is the reason only in school also playing the games alone given for them. Supplementary intake means is consulting with the doctor. If you want to take any supplement vitamin D, you consult with your doctor. Next, what are the diets vitamin D we can give for eggs, yolks, cardiac livers, is given for everything. The pictures, liver, salt water, species fish, saltwater fishes, tuna, marcorans, oysters. These are all seafoods. For example, you get for them. For not from this, apart from some also you get a diet of vitamin D, milk, cereals, orange juice, curd, cheese, juice, and protein shakes, snacks, bars, oats, milk, soya, milks, mushrooms. This is you see the picture I given. This all things for the picture form I given you, so easily you can understand for them. Next, people who have need to extra vitamin D, for especially who is, for example, breastfeeding. For example, you can also take the vitamin supplement, check for your health, how much you need for vitamin D, especially old age people, very necessary vitamin D. And breastfeeding infant, for example, that people more like very need for the vitamin D for them. People had Next one is people with dark skins who all have more dark skin, they need more for them. Next, people with certain of conditions such as liver disease and any cystic fibrosis and chronic disease like so that. People have obesity, also gastric bypass surgery, anything also they are naked. Next one is, why is vitamin D so important? Keep the bone strong. Keep your bone, yours should be strong, very helpful for them. And calcium weakness for osteoporosis wrong. I saw the picture previously. Osteoporosis for them working with the parasitic glands, blood communicating with the kidney, that purpose. This all thing very important for vitamin D. Next one is, what are the health effect of vitamin D deficiency? First one is heart disease, any high blood pressure, diabetes or infection, immune system disorder, all falls in order to people, sometimes types of cancer such as a colon or prostate, breast cancer, other multiple sclerosis. These all things are health effects will be vitamin D deficiency. Next one, can you ever have too much of vitamin D? Suppose you are taking more vitamin D, what should be happen? For example, nausea, vomiting, diarrhea, constipation should become, and increased threat of urinary, poor appetite, you cannot eat properly, weakness, confusion, dryness of water, ataxia, neurological condition caused also problem to take a higher than recommended for dose of vitamin D. Because of this all thing, why I'm saying, suppose you can take over vitamin D means this all you should have like, as per the doctors you can take for noting. I'm telling them what the diet should be, you can take this all should be a reference for them. Every day I advise to every people, at least daily go for us in front of sunlight and do in to take at least 5 to 10 15 minutes, 15 to sorry 15 to 20 minutes you go sunlight, you can in front of you can better you do some yoga exercise, your relaxing purpose. So in front of sun you can very good for your health also. Sun is easily available, you can you have relax yourself also, same time you are practice your life. So you can morning you are practice this type if you have no time also. Somebody's what happened nowadays situation, everybody busy schedule, always seeing the screen, mobile phone, never given for the outdooring activities. So I advise to everybody do outdoor activities to that you can improve for them vitamin D deficiency. You can from finally I conclude for everything. Vitamin D is only reduce for them. Still we can assess result saying, but vitamin people who all are more means that people is I am telling not COVID-19 is not affected actually. COVID-19 should be, if you want to protect yourself, like means vitamin D is very helpful for you to prevent from reduce the symptoms for them. That's only. Thank you so much. Subscribe my channel to follow me and share it to your friends and comment me any doubts you can ask. Thank you very much.
இதுவரை ஜெயம் இன்ஃபோ 5 சேனலை சப்ஸ்கிரைப் பண்ணாதவங்க கீழே இருக்க ரெட் கலர் சப்ஸ்கிரைப் பட்டனை கிளிக் பண்ணி சப்ஸ்கிரைப் பண்ணுங்க. கூடவே பக்கத்தில் இருக்க பெல் ஐக்கனை கிளிக் பண்ணுங்க. இது போல அருமையான வீடியோவை உங்களுக்காக காத்து